Hey everybody, welcome back to my YouTube channel. So today I'll be going over physical changes your body will go through after giving birth. Number one is postpartum hair loss. And this is extremely common in the first 1 to 5 months after giving birth. And I'm talking about chunks of hair coming out in your drain, in your comb, constantly just shedding. And what's happened is during pregnancy, your hormones are on an increase, which keeps your hair in the growing stage. So they stay intact in your scalp. And then when you give birth, wonk, 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 your hormones plummet. And that switches from growing stage to the resting stage. And the resting stage is when it all sheds. And it's gonna be accelerated because the quick, fast drop in hormones postpartum. And this can be really scary, hence why my haircut. My hair was actually down to here 2 months ago, and I'm like, oh, I don't want to deal with chunks of hair falling out, me thinking I'm going bald again, the whole thing, you know. I tend to lose hair on the side here, as you can see, and it's completely normal. Mine's at a normal level of hair loss, and it tends to resolve most of the time around by 15 months. I like to use techniques to conceal these bald spots or these little patches. I will part the other way. I'll chop my hair off. I will pin hair strategically. I often don't do a ponytail because it looks like I have George Costanza's forehead. So yeah, so you got to be strategic in these things. I actually personally don't mind too much if someone thinks I'm patchy or bald, because I'm so proud of having kids. I'm like, yeah, this is my pregnancy kind of scar, you know, like got my bald spot. You know, I might even display it. So yeah, I've had 2 kids, check it out, you know. Number 2 is just a beautiful one. It is some tears. Tears, yeah. So that can be common with a spontaneous vaginal delivery. And there's about 4 different types and levels, degrees of tears. There's first, second, third, and yes, ladies and gentlemen, there's a 4th degree tear. Something that's unspoken of, but it's there. So it's basically categorized by how deep the tear goes. So a 1st degree tear might just be superficial on the skin. Yeah, not too big of a deal. You may need sutures, you may not. A 4th degree tear is literally in the deep muscles and fibers. Yes, I said the word muscles and fibers. Things that can help with a tear in the meantime until it fully repairs, or most of it has repaired, is a warm sitz bath. And they say that lying down is very good as well as a cushion. I tried all 3 except for lying down because I was too busy, so I never got to lie down. I did have time to do 1 sitz bath. I did have a donut pillow because with a 3rd degree tear, I could not sit. And I remember like breastfeeding, like I was on the donut pillow, my leg was up like this. I was trying to like breastfeed and latch. It was almost like it's like a dance move. I was like trying to, you know, like this. Donut pillow. So donut pillow worked well for me because I couldn't sit really, and that eased it a little bit. Another thing that worked well for me it's something called Tucks. I believe it's Tucks, and it's a very cold witch hazel pad that it's in a container you put in the fridge, and you can place it in the tear. It cools and calms that area. I mean, that area is on fire. Okay, ladies, that area is on fire. I mean, I could put a popsicle next to my tear and it would melt. It would melt into a puddle of juice. Another physical change that may occur to you is hypothyroidism secondary to pregnancy. So, which meaning that because of the pregnancy and delivering and whatnot, you are now hypothyroid, which means you do not produce enough thyroid hormone. And it's easy enough to fix. It's a small pill in the morning before you eat. It could be 1, 2, 3, 4 pills depending on your dose. It's not a big deal. Well, you know what? It is a big deal. I'll tell you why it's a big deal. I'm mad. I'm really mad because I have to have an empty stomach when I take it, and I'm starving when I wake up. So the thought of just not eating for an hour to take this 1 tiny pill is irritating. It's actually not a big deal. I'm being a bit of a baby, but it's actually not a big deal. It's just another change that is not fun at all is incontinence. And I mean, often it resolves after a year with Kegel exercises. Every time I stopped at a red traffic light, I would do a Kegel exercise for the entire duration of that red light. And that reminded me that I need to practice. I need to strengthen my pelvic floor muscles, because with the pregnancy and giving birth, your pelvic floor muscles have been weakened. You do not want to do jumping jacks while incontinent, because I mean, it's not a pretty picture. It's really not. It's exactly how you imagine it to be. It's important to be able to not void yourself while walking, laughing, or sneezing, right? And if you can achieve that, that's great. So know yourself, know about pelvic floor exercises, and fix this. Fix this soon. Fix this within the first year of postpartum. And the next one is weight. You are not gonna walk out of the delivery room looking like your old self. It's not gonna happen. Not gonna happen. Be kind to yourself. Take care of yourself. Start by doing gradual walks. Start by taking care of your own health in terms of eating right, and hydrating yourself, and mental health, getting lots of breaks, getting help. Start there. Start there first, and then you'll build up to being able to get back to your old self. Don't rush it. Be patient. So in the post-delivery, accumulate between, you might lose 5 to 13 pounds because of the amniotic fluid, the fetus, and all that stuff. So about 13 pounds. And 6 weeks after that, it might be about 15 pounds with the bleeding and the loss of fluids. So you've got that on your side if you're counting numbers. I mean, I didn't own a scale. I just kind of did a lot of walking, and my clothes eventually fit me. So I hope you enjoyed these 5 physical changes after birth, and I think it's important that we educate ourselves and take care of ourselves and know our bodies and know what to look for, because you can't rely on other people around you, right? Hope you enjoyed this edition. Have a wonderful day, and if you have any questions or you want more data on this, message me below. Don't forget to subscribe. Check out my Instagram, check out my Facebook, check out my Twitter. Check it out. Okay, have a good night.